We've gotten a lot of questions about booster shots, especially with the recent announcement by the White House that they are planning to recommend a booster shot for everyone pending FDA approval. So first off, what is a booster shot? Well, a booster shot is an extra administration of a vaccine after an earlier dose. It's meant to boost immunity. The COVID booster shots would be taken either 6 or 8 months after your second shot. We're still waiting on the final time frame. Now, this could happen, though, starting in the middle of September, again, pending FDA approval. We talked to several experts about boosters for this story. Dr. Marcel Kurlan with OHSU, Dr. Gaurav Sahay at OSU, and KGW's medical expert, Dr. Pyle Coley. Dr. Coley weighs in first.
So I think we're definitely headed towards boosters as a population. Personally, I wish that we had our Delta-specific booster this time around, which I know the companies are working on making right now, especially Pfizer announced that yesterday. But even with the original booster, I think it really is going to help us in our fight against Delta.
It's important to point out that a booster shot is different than a third shot recommended for immunocompromised people. The CDC recommends that people with moderate to severe compromised immune systems receive an additional dose of the Pfizer or Moderna vaccine at least 28 days after a second dose. It's because those people have a weakened response to the initial dose of the vaccine. All right, let's answer some viewer questions now, like this one from Suzanne. So she emailed us saying, once the boosters are available, will that lessen the likelihood of vaccinated people spreading COVID as much, or will it just help the person that's vaccinated? Thank you so much, Suzanne, for that question. Our experts said you are less likely to catch COVID if you are vaccinated.
If you and I get one, we're going to have a less likelihood of getting infected, less likelihood of hospitalization, and also be less likely to transmit to the people around us.
And so therefore, yes, you are going to be less likely to spread it to others just because you're less likely to catch it yourself. So you're benefiting yourself, but you're also benefiting all those other people around you.
Now for our second question. So this person asked, with the booster shot coming soon, is it the same as the first 2 shots that we got, or is it different? If it's the same, then why can't we get them now? And thank you to Vincent for that question. So the booster shot is the same as the first 2 shots, but doctors say you should not run out and get another shot, get that booster shot right now, because the FDA has not approved it just yet.
Once they give emergency use authorization to the boosters, I'm going to be one of the first people to put my own arm out to get it. But right now, I got fully vaccinated in January, and it's been much longer than 6 months. I'm just about due, but I am waiting for that regulatory advice before I proceed.
Then we have this question from Jimmy, and we've actually gotten this a lot. Will there be a booster for the J&J vaccine? According to our experts and other health officials, there will probably be a booster for the J&J vaccine at some point. The company is doing research and submitted some data to the FDA this week, but it hasn't been approved yet. And then our last point, one of our experts, Dr. Sahay at OSU, said while there is a lot of talk, a lot of questions about boosters, he said there is still a large percentage of people who need to get their first shot.
Maybe around 90 million people are unvaccinated right now, and they are the major caseload. And so I don't want, people to confuse that the vaccines have stopped working. They're still safe and efficacious. We are just trying to maintain that level, and we are staying ahead of the curve. But the major issue is the unvaccinated population, and these are safe, effective vaccines, and those guys, if they are vaccinated, will be out of this pandemic, much more quickly.
Definitely an important point to keep in mind. Do you have a question about the vaccine, about booster shots, about anything COVID related? Just let us know. All you have to do is email the KGW vaccine team at kgw.com.